Well, good morning, everybody. On behalf of Screen NJ and Rutgers Cancer Institute, hello and welcome to the Community Cares and Project Echo. Thank you for joining us for today's session, and we hope that the information shared today will help you serve your community better. And now I just have a few announcements before we begin the presentation. So this is just a quick disclaimer that the information contained in this presentation is not substitute for medical consultation, and a physician should always be consulted for any health problem or medical condition. Could we do the next slide? So today's agenda, we're going to do a Project Echo series overview, introductions, the actual presentation, a case study, and then we'll do questions and answers at the end. So, a little bit about Project Echo. Project Echo is a movement to demonopolize knowledge and amplify local capacity to provide best practice care for underserved people all over the world. The Echo model is committed to addressing the needs of the most vulnerable populations by equipping communities with the right knowledge at the right place at the right time. For more information on Project Echo, you can visit their website, which is echo.unm.edu. And without further ado, we have our speaker, Dr. Karen Delonzo. Dr. Karen Delonzo is an associate professor in the Division of Nursing Science at Rutgers School of Nursing and a nationally recognized expert in community-based participatory research. Her work centers on health promotion, cardiovascular risk reduction, and the impact of acculturation, stress, and allostatic load on immigrant communities. Her NIH-funded studies have highlighted how cultural values and stress shape health behaviors, and her findings have helped establish community engagement as a priority at Rutgers. Dr. Delonzo's work now extends to addressing structural stigma and cardiovascular risk among Latino immigrants, as well as adapting community-engaged models for Asian Indian communities. She has also built strong partnerships with the Mexican consulate and universities in Mexico to advance immigrant health. Dr. Delonzo graduated from Thomas Jefferson University Diploma School of Nursing. She earned her bachelor's degree in nursing from Rutgers University Camden and a master's degree in nursing from the University of Pennsylvania. She's also a graduate of the PhD program at the Rutgers School of Nursing and is also a certified adult nurse practitioner. She's a fellow in the American Academy of Nursing. And now I'm going to pass it on to Dr. Karen Delonzo on cancer, caregiving, burnout.
Good morning. My name is Dr. Karen Delonzo, and I'm an associate professor in the School of Nursing here at Rutgers. I've been at Rutgers now for almost 24 years. It's hard to believe. But before I went into academia, I worked as a public health nurse for a number of years, and it was here that I first encountered the caregiver issues, especially in the context of hospice care to cancer patients. So in the next half hour, I'm going to talk about what we know about the topic of cancer caregiver burnout. As healthcare providers, you're likely to see these behaviors in your patients and in their caregivers. So this presentation will help you to prevent, to identify, and to address caregiver burnout issues. So almost all of us will function as a caregiver at least once in our lives, especially if we are women. And caregivers can be spouses, they can be partners, they can be adult children, they can be parents, they can be other relatives, friends, and even neighbors. So this is why when we think about the role of a caregiver, this is going to impact many of us in this discussion today, if it hasn't already. The level of commitment as a caregiver can depend upon the amount of time needed, the age and ability of the patient, the disease trajectory, and the presence of other caregiver obligations. And we see, for example, in cancer caregiving, that this concept of the disease trajectory is really important because many times cancer is now viewed as a chronic illness. and it can wax and wane, and the amount of time and the level of care needed can vary very much from patient to patient. When the long-term stressors of caregiving lead to physical and emotional exhaustion, caregivers may suffer from caregiver burnout, also known as compassion fatigue. And as you will see here in our discussion, there's a number of features of cancer care that make cancer caregiving more prone to the development of burnout. This slide here, although I know it's a little hard to see this print on this slide. Hold on just for a sec here. But I'll read this off, that caregiving often has both physical and emotional components. Meeting the patient's physical needs involves things like being present for doctor's appointments, preparing meals, housework such as cleaning and laundry, grocery shopping, assisting with physical therapy, and providing personal care such as bathing. There's also an emotional aspect to this too, that includes things like encouraging a positive outlook, validating feelings of fear or uncertainty, lifting spirits after a hard day, maintaining daily activities with modifications, connecting loved ones with outside support, and extending patience in difficult circumstances. Um, Caregiving can also involve things, and from patient to patient, it can vary, but they can involve things like nutritional support, provision for safety, pain management, financial issues. And as Sarah and I had a little discussion before the presentation today, that keep in mind that these tasks may include other activities that are essential for taking care of a handicapped individual, but may be seen as peripheral. I was thinking about this when it came to the snow day yesterday. Snow removal. When you are a caregiver, how do you handle that? If you're a husband and you were normally the person that shoveled the snow in the family, and now you're responsible for caring for your wife or another family member, you're going to have to make arrangements for somebody else to get rid of that snow. Paying bills, even esoteric activities like getting the car inspected. All of these things take time, and they're just added on to your role of caregiving. So who is at risk for caregiver burnout? And you'll see here that cancer patients in general um, require high levels of physical care. So this first item here, caregiving that involves high levels of physical exertion, these people are often at very high risk for caregiver burnout because they're at high risk for injury. So it's important to teach them about proper body mechanics and to role model that in our own behavior. A recipient with severe behavioral problems, and by that we mean things like insomnia, mood swings, confusion, combative behavior. Those kinds of behaviors are very hard to cope with for family members and caregivers. And so this may also put someone at higher risk for burnout. Caregivers who have poor or neglected self-care, that obviously, sometimes these things pre-existed the illness, that they didn't take very good care of themselves, and now they're really faced with the need to take better care of themselves. Socioeconomic issues, either the caregiver or the recipient or both. If there's money problems in the house, these kinds of things are going to add to your ability to purchase the kinds of things or to have the kind of lifestyle that you might want to have. Spousal caregivers, these kinds of problems can arise because the person feels they're, quote unquote, on duty all of the time. And it can be very difficult to watch deterioration of someone who's a caregiver. I'm reading a book right now that's a biography of FDR and his wife, Eleanor. And, I'm at the point in the book where he's, within a year before he passes away. And she really did not recognize how much he was deteriorating at all. Their daughter did, and there were other people in the White House that did, but she didn't. And this is not uncommon. Long-term caregiving. As I mentioned, the trajectory of cancer has changed greatly in the past few decades. Patients with cancer are living longer, sometimes with more complex treatment regimes that require extended periods of caregiving. So this is a different kind of story than it was a few decades back, where people, by the time they were diagnosed, often had a very short life expectancy. And that's a very different kind of coping mechanism. Lack of a support system is another thing. This increased a lot during the pandemic. We saw this where people had problems. I had a former PhD student of mine who's a faculty member in another school of nursing, and she lost both of her parents to COVID. And this was very difficult. One of them died, and then the sicker of the two died, and then her father was the caregiver. And although he was in his 90s, he appeared to be in very good condition. He also contracted COVID and died very quickly after that. So she had a real problem trying to put all of this together and get support from her siblings that maybe she wouldn't have had in the past. And then histories of substance abuse. This is always a problem. Caregivers are at higher risk for falling into substance abuse issues, especially when narcotics and other psychotropic drugs are present in the home. So maybe this person is not somebody who would normally have abused substances in the past, but now they may turn to them as a way of coping. And maybe they did abused them in the past, but had gotten themselves clean and now are having a recurrent problem. So all these people, we want to watch these folks very carefully. So what are some symptoms of burnout? Um, Generally what we mean when we look at the presentation of this, it can vary a whole lot. It may start as prolonged feelings of sadness, helplessness, or hopelessness. There's this just isn't going to get any better, that you have no way of improving the situation at all. Some people, and this is kind of consistent with depression, will feel very tired even after they get plenty of sleep, even if they have a night where they've got some assistance and maybe that person is looking after the patient during the night shift. Even after they get plenty of sleep, they still feel tired. Folks with burnout often have a lack of interest in doing things, especially things that they typically enjoyed in the past. Things that, activities, maybe sometimes those were activities that they participated in with their partner or with whoever else is the patient. But sometimes they were just things that they would have done for themselves and would have been part of a coping mechanism. Caregivers often neglect basic self-care. They are the person with the paper bag over their head. Maybe they don't bathe or change their clothes as often as they might. They neglect doing some real basic aspects of hygiene, brushing their teeth, things like that. They may have trouble concentrating, and we need to think about this when we're explaining things to them. If we're talking about a medication regime, and how to how to know when to administer medication, and this person may just have a real hard time understanding what we're talking about. Chronic feelings of anxiety and difficulty relaxing, kind of worrying about the bomb is going to drop at any given time, and this can be difficult if the person has cancer, and there are some possibilities. I remember years ago when I did work in as a public health nurse, and worked in a VNA that had a hospice program. I took care of a woman that had head and neck cancer, and it was clear that what was going to happen to her is that what was going to be her demise was probably a carotid blowout, because the cancer was just eating away into her neck, and it was a problem, and that was hard to try and prepare her husband for that. And her husband was really a very good caregiver. He was excellent, and this was a big Italian family, and there were a couple of daughters, and they were very attentive. And this was a situation that was probably better than what you saw in many homes. But trying to explain what to do, when she began to hemorrhage from her neck, was difficult, and and that is what she died of. Um, it happened in the middle of the night, which was kind of what we expected. Husband called me up. I went over there, and we kind of had prepared him for what could happen. The very sad thing about this is that he died about 3 weeks after she did. And he had a stroke, and we never really paid nearly enough attention to his physical care. We gave him a lot of emotional support, but we probably didn't pay enough attention to his physical care. And you're going to see this when we watch this TED Talk in a minute, that this is a big problem. Something they estimate that 30% of caregivers wind up dying before the patient they're taking care of does. So that's definitely something we need to pay attention to. Some other symptoms: impatience with the person you're caring for, yelling at them, losing your patience, things like that. And then changes in appetite or sleeping patterns. And again, those are the kinds of things we often associate with symptoms of depression. I also want to add that burnout doesn't happen right away often, but it begins when caregivers start to neglect the effects of caring for their own health. So this is why some of these things that we're going to talk about in terms of prevention are so important. So what do we do to prevent burnout? And a lot of these things are super easy, practical things that many of us don't even think about, because we do them in the context of our day-to-day lives, but they become super important when you're dealing with somebody who requires a lot of your attention in the home. One of the first things that we recommend is to stock up on household items and medical supplies in the home. Um, you know, make sure that you have an adequate supply of medications to help you through a snowstorm, so that you're not worrying about, as you're watching the flakes coming down, how you're going to get out and get the prescriptions, or how you're going to get the pharmacy to deliver them when they don't want to come out either. You should become knowledgeable about the recipient's condition and how your health can affect them. So, for example, you want to stay up to date on your vaccines, both for your own health and for the health of your family member. And I know that, vaccine hesitancy is more common now than it's ever been, but you are the type of person as a caregiver who should be, taking care of your health, and in turn protecting the health of other people. This student that I had, whose parents both succumbed to COVID, what happened was they had a home health aide who brought the COVID into the home, and got the mother sick, and then the father contracted COVID from the mother. So, these are super important things to keep in mind. You want to keep a list of emergency contacts and to keep a bag packed for the hospital, in the event that something goes wrong and you have to take off quickly, you've got everything there. You want to keep the recipient involved as much as possible in their own care. Whatever people can do for themselves and whatever decisions they can make in their care, you should offer that to them. Because you want to keep this person as independent and having as much self-esteem as they possibly can. You want to ask for help when you need it and accept it when offered. And we'll see this in just a few minutes with this TED Talk. You want to identify ways to take care of yourself and attend to your own medical needs. As I say, 30% of caregivers die before their loved ones do, and many more will become sicker than the ones they care for, eventually needing a caregiver of their own. So, what you don't want is two, critically ill people in the house at the same time, and then you've got to really do some major changes to what's going on. And then support groups are really important for these kinds of things too. And can really help you to get ideas from other people who are going through the same issues. This is an analogy for self-care that a lot of us talk about. When you get on an airplane to go on vacation and they talk to you about putting the oxygen mask on first, if you were to need it, before you assist, a child or someone else who can't take care of themselves. This is really good advice. And when you think about it, it doesn't take long for you to take care of yourself first so that you can then take care of someone else. Some people look at this and think that this sounds like that it sounds selfish. But the truth of the matter is, you're not going to be any good to that person next to you if you don't have oxygen on. So the very short period of time that it takes you to get that mask on will make a world of difference in your ability to care for that other person. These are some resources for cancer patients and caregivers. You'll get these slides, so all of these links should work. The American Cancer Society Caregiver Research Guide, Cancer Hope Network, NCSS Cancer Policy and Advocacy Team, and My Cancer Haven. Also, the JACC, the Jersey Assistance for Community Caregiving program. Through this program or Medicaid, the family member may be able to receive payment for providing caregiver services in the home or comparable to what you would pay a home health aide in the home. And this is really good because you often have people who will not, under any circumstances, not allow somebody else to come in the home and take care of them. And here, the family caregiver can receive some kind of reimbursement for doing this. And then another resource is the American Cancer Society Cancer Caregiver Guide, and that's also listed down there on the bottom of the slide. Here's some more. These are videos. The American Cancer Society has a series of them that are very helpful. Cancer Care Caregiving is a national organization that provides emotional support services and information to help people cope with the challenges of caregiving. And then this is another one on the National Cancer Institute, when someone you love is being treated for cancer. So this gives you lots and lots of ideas here. This next is our TED Talk here, and I'll talk about this. This is the gentleman and his wife, and I'll if you give me a second here, I'll link up to this TED Talk. She had a stroke, And this was so she didn't have cancer, but she had many of the same issues that cancer patients have to deal with, and their families have to deal with as they cope with an illness. So let me just, whoops. Okay, I'm going to close this and then copy it from the slide separately, because this is going to be hard for me to get this down otherwise.
Do you want me to send it to you in the chat?
Yeah, that would be helpful.
Okay. Because I have it right. Okay, I pasted it.
Okay. Let me try this one here. This is a little faster. It's not going to work. Here we go. Okay, so let me just cue this up. We're all set here.
Because of Rocksmith, I am ready for it all.
I wanted the word cuppa as in cup of tea, but I thought it would be great to mix with hug. When I saw the domain was available, I was like, I'm taking it, I'm trademarking it, I'm going with it. Hi, I'm Aaron, I'm the owner of Cup of Pug. We are
We
not a
can't see that your
traditional
screen
company.
yet.
When I saw Cup of Pug go live, that's when it all clicked.
Okay.
We can't see your screen yet.
Okay, hold on.
Almost everybody out there who can hear my voice is eventually going to care for a parent, a grandparent, or a loved one.
All right, let me turn this off.
Maybe you're
Okay.
Here, Karen, let me try real quick.
Okay.
Okay. Can you guys see my screen? Yes.
I can see that.
Can you
Yeah.
hear it?
No. Now I can.
Okay.
almost everybody out there who can hear my voice is eventually going to care for a parent, a grandparent, or a loved one. Or maybe you're that one that's going to eventually need care. The National Association of Family Caregivers says that 1/3 of the population of the US are already caregivers. Wow. Of those, roughly half of them are feeling down, depressed, and hopeless on a regular basis. That's according to AARP. Many of them will become sicker than the ones they care for, eventually needing a caregiver of their own. Now, the worst part is 30% of these caregivers will actually die before their loved ones do. So says agingcare.com. If you're not a caregiver, just wait. You'll either become one or you'll need one. That's why now is the time to prepare and learn how to become a caregiver. not after tragedy strikes. You see, caregivers need to learn how to become selfish if they want to survive. I know this firsthand. Let me tell you why. My wife Charlene and I had a fairy tale storybook romance, courtship, and marriage for the first 21 years of our lives together. We were in love with each other so much, I just knew I had to marry this girl before she got away. We raised our 3 daughters. We got them all out of the house. We even got them married off. All 3 of them twice. I think you're only supposed to pay for the first marriage. We now have 7 grandchildren. And right about the time that my wife and I were supposed to be entering into the empty nest phase of life, where we go wherever we want, whenever we want, don't have to worry about leaving the kids in the house to wreck the place, and we have the freedom and the independence and the finances. One day, my wife complains to me about this bad headache that she had for 3 days. She called it the headache of her life that just wouldn't go away. One day, I realized that actually it was the 4th day. On that 4th day, that headache ceased being only a headache. By the time the ambulance arrived, my wife had suffered a massive stroke, and it left her severely speech impaired and paralyzed on the right side. And in that moment, I was no longer just her husband. I was now her husband and her caregiver. The next 2 years was like a living hell for both of us. I had no idea what I was doing. I made every mistake in the book. Every mistake a caregiver could possibly make. It wasn't on my resume. I didn't even know what a caregiver was. However, I quickly learned that if I didn't become selfish, there was no way I was going to make this thing. I could have ruined my health. I might have even died before my wife would have. I quickly started realizing that I was experiencing the same problems that other caregivers experience. The first one is the guilt. I started feeling guilty all the time, but I quickly realized just because I was feeling guilt didn't mean that I necessarily deserved it. The next big problem that was plaguing me was this feeling that I was always never getting any help. But worse than that, it was because I couldn't even ask for help. I just had it in my mind, if I couldn't do this all by myself, I was a failure as a caregiver. That doesn't look good on a resume. It wasn't long before I started feeling these isolation feelings, like I was all alone in the world. My friends stopped calling, stopped coming by. I don't blame them because I was always negative and complaining when they did. Who wants to be around that? It wasn't long before I just started feeling hopeless and helpless. I remember screaming out, I don't even know who heard me, I can't take this anymore. I guess I was talking to God. I just went on in my pain because I didn't know what to do. But thank God that somebody invited me to a caregiver support group. I didn't know what that was, but I was desperate, so I went. And everything changed for me. I found people who were just like me, burned out caregivers. I found hope again. I remembered that the airlines tell us in the event of an emergency, put your mask on first before you help your loved one. What an amazing metaphor for all of life. I had to learn that if I didn't become selfish, there was no way I was going to survive this. And if I didn't survive, who was going to take care of Charlene? Let me talk about depression. with all the recent suicides in the news lately, we have to ask this question. If there is depression, is suicide far behind? Anthony Bourdain, Kate Spade, Robin Williams. These celebrities are no longer with us because they succumbed to that suicidal depression that affects caregivers as well. Yet we don't hear about how many caregivers died in the news, just celebrities. Another important reminder why caregivers need to learn to become selfish in order to survive this thing, so that their loved ones can continue to receive their care. Everybody asks me, so how's your wife doing? And I proudly say, well, because I've learned how to become selfish and put my needs first, she's doing great. She's advanced through the grief process, and she has embraced the new normal and reinvented herself and figured out that if she's still alive, God must still have a purpose for her here on this earth. Now, she still can't talk, but she can communicate non-verbally through Pictionary, charades, through games I hate, by the way, but I'm learning to love. She still can't walk, but we bought her a power chair, and she loves it. She gets to go wherever she wants now. That chair has been all over the world with me, and I have trouble keeping up with it. And anyone who meets her for the first time is thoroughly amazed at how she has a smile on her face all the time and joy in her heart. She's my hero. I am so proud of her. She's like a one-armed wallpaper hanger. And I just don't know how she does it. But because of Charlene, I can now help other caregivers stay alive and stay healthy. I want you to imagine for a moment what the world could look like if every new caregiver was already capable, ready, and healthy, and was easily able to maintain those qualities for as long as they cared for their loved one. If every caregiver can learn to become selfish in order to survive, and if they can really do that, they will become stronger, healthier, and happier, not only in their caregiving responsibilities, but in everything that they strive for in life. I'm living proof. Accent on the living part. Honestly, I promise you, you will not only survive this thing called caregiving, you will thrive, you will be joyful, and you will be the best giver of care to your loved one. I guarantee it. Just remember whose mask goes on first. Thank you very much.
Okay, I'm going to go back to sharing the slides now.
Okay, let me pop this up here.
Do you want to share it or you want me to share it?
No, I think I'm good. I was just
Okay.
finding the slide, so. All right, so I'm going to have to. Okay. So we have some questions and answers here, and then we'll open this up to any questions that you may have. Sometimes people say, what are the most helpful things you can say to caregivers when you meet them? And there's a couple of them. I think one of the first things that I tell people, and sometimes I have to sometimes I have to fudge this a little bit because because I tell them you are doing a great job. And sometimes they're not doing a great job, but they're doing the best job they can do at that point in time. And that's why, as a healthcare provider, if you find that these caregivers are not really doing a good job, you can start off by saying, you are doing a good job. You are doing a great job. I have a couple of ideas for you, and then go from there, because you definitely want to acknowledge that even somebody who is a lousy caregiver is probably doing the best job they know how under those circumstances. Another thing that you can say to people is, no one expects you to do this alone. Just like the gentleman in the TED Talk. Nobody expects that, and it gives them permission to say, I need help, to reach out and look at their support network and to ask for help. And then the third thing is, what kinds of help could you use right now? Because sometimes our conception of what they might need is very different than theirs. They may just need some. We used to, when I first got married, we lived in Cape May, and I worked as a supervisor in a visiting nurse organization. And I remember one woman that we had that had colon cancer, and she had just had a colostomy, and her daughter was schizophrenic. And this was really hard with the daughter. Oh, and for a period of time, all we did was we sent a community health worker, who was a nurse's aide kind of person, out to the house to take the woman who was schizophrenic out for a walk on the beach every day. And we had a nurse there in the meantime who provided the care for the colostomy and everything. And that was the way that we got this woman, and we made sure she was taking her meds and everything, the daughter who was schizophrenic. But once we got her stronger, then she could provide some of that care. If we had jumped right in and said, you need to be doing more work for your mother, it would have been a disaster. But we had to get her straightened out. And that walk on the beach in the morning made all the difference. It was really amazing. One of the questions that sometimes people ask, and we addressed it a little bit in this talk, was, how can I get paid for taking my care of my grandmother at home? And there's a link a few slides back that tells you how to get access to that program so that you can take advantage of it. Okay, so
now we'll open it up for if anybody else has any questions. You can put it in the chat, or you can even unmute it. I know I have a question, so I can go first, actually.
Sure.
How do you think that healthcare professionals right now, like, what can they do to improve how they support a caregiver?
I would say probably getting back to that slide that we just looked at, that said to ask people, what can we do for you right now? Again, because you're not going to really be able to understand what that caregiver is capable of doing unless you can open yourself up to say, what could we do for you? And it could be all kinds of things. It could be, I need help making meals. I'm a lousy cook. I need somebody to stay with her through the night, because that's when she's most uncomfortable. That's when she often becomes disoriented and calls out. It can be things like, I need somebody to help me get her out of bed. We think of common physical things like that. But if you have a caregiver who's elderly, who has a lot of arthritis, who's got, problems, maybe the patient is like twice the size of the caregiver. I often tell this story of a patient that was my husband's uncle, and he and his wife lived in Tennessee, and he had rheumatoid arthritis, and he had been ill for years, but got around okay and everything, and eventually he got bedbound, and he was a very big man, and his wife was a very tiny woman. And to make a very long story short, what happened to this man was that they got him a new hospital bed, and it was an electric bed. The bed shorted out. They had a fire in the house, and he died. And his wife was like the consummate caregiver. I mean, she did everything for this guy, and she was asleep when it happened. One of the sons lived in the house with them. He was in the bedroom a couple of doors away. He heard his father calling out for help, but by the time he could get in there, there was a ton of smoke and everything, and they couldn't get this guy out. And, that's the kind of thing that maybe we need to talk about, with people, how to get somebody out of bed if you would need to do it in a hurry, who to call, it happened also quickly that they didn't really have the opportunity to put a lot of these things in place. But sometimes we do a real good job of handling events that are right in front of us, but we don't often think about what would happen if this happened and how would I respond. So, asking people what they need and then trying to anticipate a little bit ahead is probably some of the most important work we can do.
That's a really sad story. It's horrible.
Oh, it was very sad, and she had been his caregiver for years. That I mean, when I got married to my husband, this was going on, and we were married many, many years, and we were still hearing about them and all this kind of stuff. And he eventually got more and more bedbound, but he was a real big guy. He was about 6'7", and even after being sick for a long time, he still was a good sized guy. So it was hard for his wife to even think about getting him out of the bed. The son was also pretty big, but by the time he got in there, his dad was already gone. It was really sad.
Stuff like
Any
that you can't expect to happen, right? That's just very, like, I would never have thought that would.
No, no, but again, sometimes we forget to think about prevention, and these kinds of things, like what would I do if? It's certainly not the first thing you want to drag out on somebody, because you'll send them into a panic. But as you start to get to know people, patients better, if you're following these people over a long period of time, you might want to, and they have a pretty good handle on what is going on in the care of the patient. Then that might be the time to start asking about, kind of emergency situations. We have a faculty member in the School of Nursing who does a lot of research about, she was in Tom's River, and she went through, Superstorm Sandy, and that was one of the issues that she had, was how do you get people out of the house when they're bedbound? How do you, if the room is going to flood out, or if these people are right down on sea level and there's going to be problems, how do you account for that kind of thing? And sometimes we don't spend much time thinking about stuff like that, and yet we should, you know.
Yeah, we should actually. I haven't even thought about that either, but yeah. If anybody has any questions, feel free to unmute. If you want to ask your questions later on Mighty Networks, you can do that. This will be posted on Mighty Networks, as well as all of the resources Dr. Delonzo shared. It'll all be shared there. You go to the next slide. I don't know what else I.
It's not moving. Oh, there we go. Okay.
Okay, so I have a few upcoming events that I just wanted to highlight. So like we did last year, we did our Back to Basics series. We're doing a screening and prevention series, and our first one is launching February 11th, and it's on the relationship between HIV and cancer. So I'll put the link for that in the chat, but it's also already on the Mighty Networks. And then we also have an event on the 4th for World Cancer Day, which is United by Unique, and we're going to highlight some of our partners. I know Iris is here. She'll be there. She'll be one of the panelists. But yeah, we have Horizon Blue Cross Blue Shield, the New Hope New Community Development Corporation, Bergen's Promise, and Brenda Green will also be there. So I'm going to go ahead and put all those links. Make sure you do the evaluation form. We do look through them and we like to see what you guys say. Thank you guys for attending today's session. Thank you so much, Dr. Delonzo, for
You're
doing this
welcome.
for us. It's always a pleasure. And then our next survivorship session in February is on lifestyle patterns and breast cancer survivorship.